in this diagram of the skull, we see that there are, this is not a cross section, but this is a mid-sagittal section. So like if you cut yourself down the middle and you have two halves of your skull, we can see that there are some spaces. And so I mentioned that there are some sinuses. This one is in the frontal bone. So this is what we would call the frontal sinus. And sometimes you can feel this when you have allergies or a sinus infection. It gives you a headache like right above your eyes. And you can massage that area and sometimes get those sinuses to drain. You also have in this pink region, this is your sphenoid. And this is a bone that is really deep in the brain. And these are your sphenoidal sinuses. So we see two sets of sinuses here, which are areas that can get infected, but actually also help to lighten the skull and in some cases humidify the air that we're breathing in. Specifically, we're going to look at the ethmoid bone and the ethmoidal sinuses that do that. There are also sinuses in your cheeks, and those are called the maxillary sinuses, and those cannot be seen in this particular diagram. So let's look at this structure right here. This is what is referred to as your ethmoid bone. And if we just look at the ethmoid bone, it has an interesting structure. So this is looking at it from the front. So here we see that there is a projection up into the cranium, and this has an interesting name. This is called the crista galli. And this connects to the meninges, which are the coverings of your cranium, of your brain, right? The meninges. We also have a structure coming down here. This is called the perpendicular plate. So that makes up two sides of your nasal cavity, right? And then we have what are referred to as the conchae, which are these bony structures that actually help to create turbulence in the airflow coming into your nose so that things fall out of the air and they do not get into your lungs. And so these are what are referred to as the middle nasal conchae, or conchae, middle nasal conchae, right there. Now, these areas right in here, this is where your ethmoidal sinuses are going to be. So when people have sinus surgery, for example, they go up and into the nose, and oftentimes they remove a lot of these little bones so that they open up the sinus cavity so you're less likely to get congested. If you have chronic congestion, sometimes these sinuses can be completely blocked off, and that can be a big problem, right? That could give you chronic headaches, for example. Now, there is another interesting structure located in here, and this is what is referred to as the cribriform plate. The ethmoid is your inside of your nasal cavity. And so up in the top superior region of your nasal cavity, you have olfactory nerves. And those nerves actually have to travel from your nasal cavity up to your brain, right? Your olfactory bulb, which is in your brain. And so they actually travel through these small holes. So it's called cribriform because it has tiny little holes like a cribbage board. So small holes through which olfactory nerves travel. Olfactory nerves travel. And that is your cribriform plate. Okay. This is a diagram showing the bottom of the skull. Some other structures that we can see would be right here, that is your zygomatic arch. This is your foramen magnum. And then you have the palate. So this is not showing the soft palate, which would be here, but the hard palate. And in the hard palate, we actually have two bones that make up the hard palate. So again, this is a structure that consists of bones and bone markings. So we have the palatine process. Palate, like palatine process of the maxilla. We also have what is called, and that would be right there, we have the horizontal plate of the palatine bone. And those two things make up your hard palate. So again, when I ask for bones and bone markings, this would be a good example where you can't just say maxilla and palatine bone. You need to tell me what part of the maxilla makes up the hard palate. What part of the palatine bone makes up the hard palate?